positioning. You must put on the probe somewhere. Only after next, will take it, prevent falling, and then take a positioning. Usually we are in gloves, that's why you may touch easily. I will try not to touch our patients. Here we have a screen. It is a mobile device, that's why we have the device for fixing the screen. What we shall do, what you will do, pardon. First, several points, several drops only of water. You will put it here and try to find out that picture. The direction will be like I do. Pay attention. No, you have not. I will show you. Look at this. The direction. You see how? Pay attention at screen. That black lines. It is a ribs shadow. Through the ribs we cannot see nothing. This line, it is a pleura. If we have a distance between that line, that gray, it is a tissue of the lung, normal tissue of the lung. If we see distance between the pleura and some other parts, what it means? We have a pneumothorax side blood. But for assessment, we should place the probe in that direction and see the best overview of lung tissue. Again, we see the pleura, we see the tissue. If your patient, your colleague will make a breath, do it. We see the movement of the lung, you see? Nice. That horizontal lines we call A lines. It is normally presenting everywhere in the lungs. If we see the vertical one, we call it B lines. It can be present, but no more than one or maybe two. Big amount of B lines, vertical lines, means that your patient has inflammation. It is a normally looking lungs tissue. Everything is perfect because he is healthy. Maybe a smoker, but we cannot see it just now. We can see it here if it is. If not, we cannot see even here. We are sliding here, and here we have a spleen. It's not easy to find. That's why you should first focus on positioning. In some case you will find the best picture. Again, it is a black, it is a ribs. It is a normal picture. Among the ribs we have some structures. For example, here we have a partially part of the spleen. Pardon, it's a hepatic zone. And what is interesting here for us, it is a placement when we have a hepatic picture. Look at this. Just nearby we have a lungs tissue. And if he will make a breath, make one. We have a touching point. It was absent of the lung, and now it is absent, and now it is a present of the lung. That is lung. Then exhale. No lung. Again. That is lung. Exhale. No lung. It means touching point of the lung. It is a sign of pneumothorax. It means that all of us has pneumothorax, you remember? But where? In some tiny placement. It is just here and from opposite side. Your task to find and put on that point. If you understand how it's looking, even here you will find the same picture. It is a pneumothorax. Normally we have no pneumothorax in upper parts, never. We have here only what? Tissue of the lung with the A lines, pleura and other positions. But here we can see, we can view it, and your task is to find out the tissue of the liver first. Then during breathing, find out the touching point of the lung. Yes, here it is. It is a sign of pneumothorax, normally presented in all our cases, okay? So, in down part of the lung, we cannot see nothing, of course, nothing bad, I mean, only lung structure, and we have no vertical B lines. It means that he is quite healthy, normal picture of the lung. Then we are transferring below the ribs. What for? Again, we try to find out together kidneys, hepatic zone, and maybe lungs picture. Here it is rounded shape, you see? This rounded. It is a kidney. Above it is a what? Hepatic zone. You may in this position transfer in that direction. You see what we will see together. Again the same things. Hepar is good enough, and here is kidney. That is kidney. Very nice. What is this? This is a lung tissue. All three organs together. That is our purpose. What for? If we have damage of any organ, what we will see? We will see the distance between them. Just now we have no distance. They are glued together. It means we have no troubles. Again, colleagues, you should find that picture. Slide in and finding the best positioning. It may take some time. Here it is another zone. And here we have two organs, but it's still good for understanding and overview. It is a kidney and plus hepatic zone. Without without lungs tissue, but at least two organs together must be glued. It is our main purpose. Catch? Yes. Okay. Next, we will go here. Try to find some positions here. Actually, the same liquid we have no. After we transfer to the osseous part of the pelvis, just here, it is our oriented. We are looking just here, the part of the what? The part of the peritoneum. That white, it is a peritoneum. It is that pocket which we are looking for. And again, between this line and the internal organs, in case of tragedy, surgical situation, we must have the space filled with the water. It is a black space. Next, we are transferred to the umbilical, to the bladder zone. Bladder, how do we call it? Bladder, eh? Bladder, okay, bladder. I must remember. In some cases, we cannot see the big bladder, but later it will be. Here it is. Some. It is not. Here it is black. That black rounded shape. It is a bladder, and it means that no other liquid is nearby. Next, we are sliding here, looking for the peritoneal zone. White spot. It is a peritoneal zone. If you will transfer in some other direction, you will see another picture. It is also peritoneal zone. It is also possible to find, so you may transfer, shift it, and it is okay. Then you are going upward, looking about spleen plus kidney. Spleen is tiny, usually of triangle form. So in some cases you may shift position and go to the opposite side because it may be easier for you. But usually you will do it from one point, and usually if you are qualified it takes no more than 5 minutes. Just for understanding, does you have damage, I don't know. So it's very valuable mechanism. For that, the same actually, you must find out either 3 parts, either at least 2 parts of organs, internal organs. Again, you must slide in and find in. At least like here. It is a muscles. That gray are muscles. Internal parts of bad overview for us. It means that we should find the better picture. We are focusing on kidneys first. Kidneys may be reached from upper part, from that position. Here is spleen, here is kidney, you see? This part of kidney and upper part of the spleen. They are also glued together. Partially you cannot see, in some cases you cannot see the full rounded shape of that organ, but you must try to find out at least part of it, like here for example. This is spleen, this is part of kidney. Again, they are glued together. Now we try to find out the symptom of pneumothorax. Breathe again, please. Again, touching point. You see that horizontal lines. It is A lines. Absent of them means we have something other. And when it's appear, it is a touching point. It is a tissue of the lungs. Here, upper part of the lung, the same. We will find out the better overview. Breathe again. And the last position, we must try to put on and find the heart beating part. It is a hepatic zone. If we cannot reach through that overview, through that point of view, actually we may, you see, it is a beating heart, his beating heart. But in some cases, it's not very good to pass through that direction for us. Then we slide just here. Actually, our purpose to find out the pericardium. Why we need several syringes? Because we empty one by one, and it may take a lot of water. But it's easy to remove. That's why it's better in comparison with the gel. What about our heart? He has no heart, Joe. You see, this is the beating. We may transfer to that position. It is a parasternal view. We have both overviews, and in some positioning, we may slide to that positioning. It is also heart beating. Again, our main purpose to see the liquid. We have no liquid outside the heart cavities. It's nice. At least he has a heart. It's nice. It is a IFAS protocol. Again, your task to find out all necessary positions. Of course, we must not kill him. That's why 2 or 3 persons. Next day, another 2 or 3, maybe with another model. Again, what is unclear, colleagues? What to do is clear. Your task is clear. Perfect. Then I leave this device nearby. Who will be the first? Will take my seat and do the same thing.